As you've heard, my name is Moses Nderitu, and I'm from Afya Research Africa, where we've also rebranded ourselves to Ubuntu Health Limited. Now, at the turn of the century, when the global health engines were revving, I found myself being a young epidemiologist, clinical epidemiologist at one of the premier research institutes in Kenya. And one of my responsibilities was actually collecting data, doing research, analyzing, and above that all, reporting that data to global bodies like Gavi, World Health Organization. But I did recognize that the data we were having was having serious issues. One, it's because there was a disconnect between clinicians and researchers, and that researchers felt they were doing something different from clinicians. And we needed a system of where we could actually collect data contemporaneously, but also make sure that the care we were giving patients was very good. And therefore, I dived into the art of trying to start learning how to program and create electronic medical record system. So the story dates back from 2004, but the first system was written in 2006. So at Afya Research Africa, we have electronic health record technology tools that empower health workers, assist communities to attain quality essential healthcare. And populations living in difficult to reach areas are faced with poor primary health records, poor aggregated records, and poor health outcomes, as you can see from that graphic over there. And we designed Stone HMIS to support better primary and aggregated health records and management of healthcare processes for best outcomes. So you can see there I show you poor client health records, poor aggregate health records, and eventually poor individual and overall outcomes. And that linkage is clearly demonstrated even in research. We began as a non-profit and established a track record in putting up primary healthcare facilities in difficult to reach areas. And I want to underline difficult to reach areas, because I had people talk about Turkana, Migori. We have very, very strong presence in those areas. And I've just returned from there, setting up one of the biggest connected system, connecting about 10 facilities, and the first of its kind in Turkana. And I think some of the people who are here can bear witness to that. Now, we built 25 successful primary healthcare facilities, which are still running. Each of these facilities runs Stone HMIS, which is a solution I'm presenting here, to manage patient care. And Stone HMIS has grown in capacity to support more work beyond the network. And this includes having things like centralized, unique personal identification and connectivity to national health data systems, including contribution to interoperability efforts in the country. Now, dispensaries, health centers, small to medium private hospitals, drug shops, and individual practices, which we estimate make 70% of the health facilities in Kenya, are our main target. We also target mobile applications based on Stone HMIS at primary consumers of healthcare in these facilities. So you can see we are very, very well, we know our market very well. And you can see that 70% of the 10,040 is what makes up our target market. Our business is anchored on building our feature-rich Stone HMIS with subsidiary mobile applications, alongside auxiliary services of building the requisite infrastructure, training on use of EMR and applications, and data handling. We rely on partners in infrastructure and maintenance and training, while we concentrate on our core competency of innovating Stone HMIS and related applications. So that simply shows you what value we are going to be of to the fraternity, the medical fraternity, the ICT fraternity, and all the others. And we will generate revenue from premium functionalities of Stone HMIS, support and training, infrastructure installation, data handling, direct sales of devices configured to work with Stone HMIS. As I have described, it's not only a CAPEX system, which begins at a clinic level, but also works at a wide area network, and also works at a centralized level where we have servers sitting within Google to coordinate the work of unique central identification. I think we can talk about the solution much more after this. And with a total of about 1.5 million US dollars, which is what we are looking for, we project that our business will become profitable within 2 years. And by 5 years, we'll have complete return on investment with sustained profitability. The red line you see there is the growth of our clientele. And we've done a very careful modeling with assistance from GSBI, as well as partners from Innovations in Healthcare. And you can also see the expected revenue yield and the gap, and where we expect to actually break even. Finally, ultimately, as you've heard, we want to ensure healthy lives and well-being for all ages within sustainable development goals by contributing to the realization of quality essential care through high-quality records that facilitate work of healthcare workers. So we want to increase the number of health facilities that are providing EHR technology. I think people have heard this to a point where it's become hackneyed, but I want to assure you, we began at a time when even the words EHR, EMR were not existing. We just wanted to innovate something that was going to be of use. And over the years, when new terminologies have come in, like interoperability, we've just been there. And when people are thinking, wow, this idea is probably outdated, we are still there saying, we are not yet there, and we are going to help in growth of this important ecosystem. Finally, I just want to say I'm not the only one here. I think members of my colleagues are here, represented by people we code with, my executive director, who I met when we were working together in research, and I think we are a group of about 5 of us in here. So I want to recognize their presence. Thank you very much.